We're here with Dr. Shluper again, a dentist from Bloomfield, New Jersey. It's been a while that we spoke. Dr. Shluper, how are you?
Fine, thank you, Sir Helmut. It's great to see you.
Yeah. Dr. Shluper, you talked about implants a lot already, but there's lots of people who apparently really want to know, just kind of the basic. And they want to know an implant versus a crown and a bridge, kind of like, what is the story about implant being so much better than crown or bridge, and is it always that case? So give us the pros and the cons of an implant and tell us the advancements which have been made in that field. And please also, because you talked about how a missing tooth is so devastating, gets you headaches, can make your face bad looking, all kinds of things, and even makes your existing teeth looking bad, and that's why people are supposed to replace their teeth, and implants and crowns are kind of the options to do. But you have lots of data on it, so tell us some of that new advances which are out there.
Yes. Ideally, we should have all our teeth. The teeth are not just for aesthetics and to look good and to talk nice. The role of the teeth is to chew and to break down the food. And as we break the food, we allow to the saliva to break it further before it would enter into our stomach. If the food is not broken all the way, then it would be ingested, and all the benefits of the minerals and the vitamins that inside of the food would not be, we will not receive those in our system. So the less teeth that we have, the worse we are, because the food will not be ingested correctly into our body. Now, in cases that we lose a tooth, we do have some options how to restore that missing tooth. We can do it either with a bridge, either with implant, either with a removable device. There are advantages and disadvantages in any of them. The implant is the most sophisticated choice. What it really is, it's like a screw that would enter into the bone, and over that screw there will be a crown that would restore the tooth as if it were our previous tooth. It is a solution. It does require a surgery. There are cases that the bone would not be integrated with the implant, but today most cases are integrated.
You're using the same that metal stick which goes in, that implant basically is the same material than they're using for hip replacement and knee surgery type of stuff, like the titanium, right?
There is, yes, and there are plenty of other materials. There are other materials. There are differences in the integration of those materials with the bone. Mm-hmm. But the implant came a long way, and it's getting accepted, and we do get the benefits of the implant.
How long does an implant last?
One thing is...
How long does an implant last on an average? I know you don't have a real number probably because it's different for everybody, but on an average, does an implant last a lot longer than a bridge?
It may. When we usually speak about success in implants, we're talking about more than 10 years. That's usually the success of the implant. It may last much longer.
I see. So we don't have much more background than about 10 years, but implants have been around for at least 20 years, kind of, no?
Much longer. There are cases that last much longer than 10 years, but we cannot predict. Mm-hmm. That's what I'm trying to say. There are now implants that are very short and they fit into a very small bone. There is a risk though if you have a canal inside of the bone that we wouldn't be able to place an implant right over that canal. So there are risks and there are benefits with the implant, but it is one of the solutions. There is a different solution which is a bridge. A bridge would be at least 3 crowns united one to the other, and they are cemented over the neighboring teeth to the missing teeth. This procedure does require of filing down the neighboring teeth to the missing tooth. If there are...
Is that a really bad thing, or doesn't really matter whether it's happening? I mean, obviously you need an injection when a person does that, but you need an injection for an implant also, I suppose. So
yes,
anyway, is the grinding down a really bad thing, or does it really not matter?
It depends. If it is a natural tooth that was not touched before, so there is a risk if you start to filing down from that tooth. On the other hand, if the neighboring teeth to the space already have a crown, so there is no any risk of replacing those crowns into a bridge.
Got it.
So you can do that.
So if the neighboring teeth are already damaged, a bridge at the very worst, it doesn't damage anything already because it's already damaged. So you just hang another tooth in between and that's it. But if the neighboring teeth are perfectly good teeth, then it's kind of, think twice about grinding them down and damage them, so to say.
Right. It's a very personal preference. There is a different kind of bridge that you may not have to grind the teeth all the way. There is a way to have a bridge that would be hanged on the neighboring teeth without having them too much grinded. That's also a possibility. That also has advantages and disadvantages, but it's also one of the possibilities. The other option is simply to have a removable device that would not require anything, any grinding of the neighboring teeth. People would put it in and would take it out. That's the simplest and the least expensive, but many people would not feel comfortable of taking a tooth out when they have an option to have it fixed in.
Right. For instance, let me ask you, so if you have one of those removables, it's probably difficult to chew on a spare rib and eat an apple with it. At least it feels uncomfortable, right?
Yes.
If you have a bridge, can you eat an apple and a spare rib, or do you still have to be very careful about that?
You can eat anything.
A bridge is pretty strong.
Yes, you can eat and you can use it as if it were your natural tooth.
Good. So obviously the implant, which seems to be the golden standard now for replacing a tooth, is minimally as strong or even stronger than a crown and a bridge. Yes or no?
There is one thing that implant would not have, and it is the sensitivity to pressure. A natural tooth has the ligaments that that connect the tooth to the bone.
Right.
The implant does not have that.
Yeah.
So you may bite over the implant with a very strong force, but you would not feel that force.
So you might, a little bit like, well, we get burnt. Basically, almost all pains are actually an a safety system for our body. If we wouldn't get burned, we would keep the hand on the fire. It would still burn, but it wouldn't hurt. So when we take it off 3 minutes later, we say, oh, no hand anymore, right? But because it is hurting, we go, oh, right away. So is that what you're saying is a little bit missing with an implant, and thus sometimes a person could be getting carried away?
Yes, that would show up only in cases that the whole mouth has only implants. If you do have some natural teeth, you still would feel the necessary pressure that would prevent you from applying too much pressure over the teeth. Right.
Okay, good. So the point is, we can put implants in it, and crowns and or bridges, and we can make the mouth functional so that it bites correctly, so we don't get headaches, we don't get neck pains, we don't get caved-in faces looking bad because the bone starts disappearing, or the missing teeth kind of make us, looking like that, and chew the food correctly, and least but not last, look good. Even though quite a lot of that missing teeth thing happens in the back and people might not see it, but either way, the function is as or more important, as you mentioned at the beginning of the video. And there are replacements. Let me ask you, there's a crown and a bridge, let's say one missing tooth, you need a 3-unit crown, bridge, and an implant. Is the price difference really very, very much, or is it really not all that much?
Yes, the price vary. The implant is quite an expense. It is expensive, and it is a much more sophisticated procedure. So it's also a consideration.
But the point is, you can give the suggestions, number one, and number two, whether an implant is a lot better than a crown, the crown and the bridge, they do their job. Would that be your answer? Yes.
Yes, the crowns and bridges and implants, they all do their job, and we are very lucky that we do have those solutions
and choices.
Yes,
financially and otherwise. So absolutely great. Very informative. Thank you very much, Dr. Shluper.